fear of catching COVID-19 has dramatically affected the dental industry. So according to a new Harris poll, a lot of people have been opting out of seeing their dentist during the pandemic.
Some dentists say that's a bad idea. Crystal Young visited Green Street Dental in Soho. She has their story and a few tips.
We're ready to bring the patient in.
Dr. Martin Aronoff has been practicing dentistry since 1976. He and his brothers Michael and Robert followed in the footsteps of their father, Captain Samuel Aronoff, who was a dentist in a World War II MASH unit. Returning home to New York City, he opened Spring Street Dental 75 years ago, which eventually moved to Green Street. But now business is suffering, with dentistry taking a huge hit since the pandemic began.
One thing we should understand is that dentistry as an industry has been dealing with infectious diseases always. We've always been intimately close to somebody's mouth and breath, and so going back to diseases like hepatitis, the AIDS epidemic, SARS, bird flu, swine flu, we've been monitoring and managing these issues always.
One of the biggest areas affected, patients who are canceling their appointments with the hygienist.
A lot of people are going, well, it's just a cleaning. Well, I'm sorry, it's actually, the cleanings are one of the most important things we can do for you, because that's maintaining your periodontal or your gum and bone health, which support your teeth. Also, what we've learned in this industry is that the oral health is intimately integrated with your systemic health. So it's not that gum disease is going to cause you other medical problems, but it will hinder your ability to manage other medical problems.
Vera Groff has been a loyal patient since the late 1970s.
Aronoff, and Aronoff. So the two brothers I was involved with was Dr. Robert, who was my dentist, and Dr. Matt, who would do the root canals, which he did impeccably. You just didn't feel anything. And they were just caring, wonderful neighborhood people.
Staggering appointments so there's no one in the waiting area is just one of Green Street Dental's many safety protocols.
We practice very safe methodology for cleaning the environment, air filters in the rooms, closing off open doorways. I personally have not heard of any COVID-related issues associated with either the dental community itself or patient population.
For almost 15 years, Dr. Aronoff was a professor at NYU's School of Dentistry, teaching in clinics and lecturing. Now, although business is down, he's staying positive.
The landlord bought this building when we were already in place. And this is an investment company. They have a bottom line, they have relationships that they have to maintain. And I understand that, but I need to survive.
Now for a few dental myths. Myth number one, more toothpaste means a cleaner mouth.
So toothpaste companies are making a lot of money on you using a lot of toothpaste, and you can save a little bit of money by just using a little bit. All you need is a little dab.
Myth number two, you should brush your teeth for 2 minutes.
It's the same thing with any physical task that you do. Some people are faster and good, and some people are slower and good. The good is the important part, not the time.
Myth number three, brush in a circular motion.
I don't care what technique you use, as long as you do an efficient, thorough, and non-damaging job.
Dr. Aronoff recommends using a soft bristle toothbrush and be gentle. Being aggressive can lead to gum recession. Brushing up on your dental health just makes sense, so skip the candy and that sugary soda, but don't skip your next visit to the dentist.
So there is your cautionary tale. Dentists have one big message for you. We want you back. Go to the dentist and take care of your teeth and gums. There you are, ladies.
All right.
Good advice.
Yes,
Thank you,
keep
Crystal.
smiling.
All right, our next guest.
Yes.
She